All right, good morning. Everyone here is familiar with the high stakes in healthcare decision-making. Even though government put billions of dollars into hospital services, there is always a need for more. Everyone wants top quality care as close to home as possible, and people expect to have a say in how that care is provided. When the Ontario government created the Local Health Integrated Networks, or LHINs, it didn't just promise that LHINs would consult the public, it put community engagement right into the LHIN legislation. The minister at the time, the Honourable George Smitherman, said this would make it, quote, very clear that decisions must be made on the basis of the public interest and in the full view of the public, unquote. The investigation I'm reporting on today found that the Hamilton-Niagara Haldimand Brant Local Health Integrated Network failed to live up to that spin. It made some controversial decisions on hospital restructuring, which it had every right to do, but it didn't adequately engage the community. And it didn't always meet in full view of the public. L'enquête que je présente aujourd'hui a conclu que le LHIN de Hamilton-Niagara Haldimand Brant n'a pas été à la hauteur de ses paroles. Ce LHIN a pris des décisions très controversées sur la restructuration d'hôpitaux, ce qu'il avait parfaitement le droit de faire, mais sans obtenir l'engagement adéquat de la collectivité. De plus, il ne s'est pas toujours réuni en pleine présence du public. People complained to our office about the lack of community engagement in two restructuring decisions involving Hamilton Health Sciences and the Niagara Health System. Our investigation revealed that despite strong language in the legislation, the reality of community engagement is that it's in a wishy-washy gray zone, and that this particular LHIN took advantage of that to render it almost meaningless. Let me give you 4 quick examples. First, we learned that board members actually counted conversations that they had on the golf course or the grocery store as community engagement. One member told us that's how we concluded that most local people were in favor of the restructuring plan. But what about those not fortunate enough to belong to the golf club or be in that grocery store? Second, we found the LHIN board didn't document these informal consultations, so its members could cherry-pick anecdotes about what they heard from local citizens in the grocery line, in the golf course, in town hall meetings and arenas. Third, the LHIN relied on consultation done by health service provider rather than doing its own, even though the documentation in these meetings was sadly lacking. In Hamilton, the LHIN board viewed a slide presentation on the restructuring plan just before it gave it the green light. Of 51 slides, only 2 referred to community concerns. Fourth, we determined that the LHIN board members adopted an illegal bylaw, allowing them to meet behind closed doors for so-called, quote, educational purposes. They then used these secret clandestine meetings, 7 for the Niagara Plan, 4 for the Hamilton Plan, to discuss the restructuring plans with the key players away from public view. I found this very troubling, especially because this very same illegal bylaw was adopted by LHINs across the province, creeping like hogweed through Ontario communities. Even though the LHIN claimed no decisions were taken at these meetings, they clearly furthered the decision-making process. Members of the public are left to wonder if the meetings they're allowed to attend are just a rubber stamp, with the real engagement going on in private inside the LHIN's boardrooms. Sadly, the LHIN's response to my recommendations throughout the process was defensive and recalcitrant. Its attitude was essentially, we did nothing wrong and we won't change. The ministry, however, agreed to work with all the LHINs to establish standards of community engagement as I recommended. And yesterday, a full year after it received the preliminary draft of the final report, the ministry ordered all LHINs to rescind their illegal bylaws and stop holding closed education sessions. I welcome this late development from the ministry, as it will bring LHINs in full compliance with the law and will increase transparency and accountability in their decision-making. I will keep a close eye on this issue as the ministry reports back to me on its progress. Comme je l'ai dit dans mon rapport, les LHINs sont appelés à prendre des décisions difficiles, parfois impopulaires, à propos des services de santé. Ils ne peuvent pas donner satisfaction à tout le monde. Mais si le processus n'est pas ouvert, les gens resteront confus, mécontents et méfiants. C'est l'intégrité de tout le système de l'LHIN dans la province qui est en jeu. As I say in my report, LHINs must make difficult and sometimes unpopular decisions about health services. They will never please everyone. But people will be left confused, dissatisfied, and distrustful unless the process is open and transparent. The integrity of the LHIN system across the province depends on it. I'd be happy to take some questions.
Mr. Marin, your investigators spoke with people at other LHINs across the province, not just this one. You found that they had adopted this secret bylaw. Do you think there were similar circumstances where other healthcare decisions were being made secretly at these meetings?
There's no way of telling right now, but I wouldn't put it past them. I mean, I think there was a certain frustration with the legislation. If you look at paragraph 35 of the report, the principle is you have to hold public board meetings. And the reason for that is to engage the community. But if you look at the statutory exceptions, they're very narrow. They're listed at paragraph 35. They have to do with public security. So someone's public security is in question, you can have a private meeting. But beyond that, I think there was a feeling among the LHINs that they were hamstrung. So they adopted this provision. And I want to make clear that I have no particular opposition to them being able to hold education sessions, except a bylaw is a byproduct of legislation, has to be enabled by legislation. You can't just add to legislation that you don't like. And secondly, these were not used as education sessions. I mean, I don't have any exception to people, board members at LHINs, getting education session about how to work the computer or getting up to speed on ministry legislation. But you can't, use an illegal bylaw to then cram in submissions that you don't want the public to hear. And admittedly, public meetings are a lot more difficult to hold than private meetings. And one of the reasons is because people like you show up, the media. But, such is life.
Considering that the consultation process was flawed, should the decisions that the LHIN has made be re-examined, be reopened?
It's a good question. Right now, it's in the government's hands. We made 3 recommendations, and right now they've all been fulfilled. But if this press conference had been held yesterday at 9:31 a.m., there would be the most important recommendation unfulfilled, which is to get rid of the illegal bylaw. Now that's done. The government has our findings. The LHIN has the findings. It's up to them right now to decide what the next step will be.
The government or the LHINs?
Either one of them. The LHINs can revisit their decisions. The government can order it. And unfortunately, when you do these meetings privately through an illegal bylaw, you are exposing yourself to judicial review. These LHINs that did substantive deliberations and took in submissions and had discussions which were undocumented, out of the view of the public, have now put themselves in a very precarious situation vis-a-vis the law. And it's dangerous to do that. So I'm glad that bylaw has now been struck down, and now the board meetings will have to abide by legislation.